I'm going to be talking now specifically about biofortification. The kind of the plan of the afternoon was to look at agriculture more broadly, and I'm very excited about some of the takeaway messages that I've gotten from the panel. One is to show impact. That came out very clearly. We need to show impact. And another one was, well, there's an excitement, a recognition that we need to link agriculture and nutrition, but give me some examples. It's all very theoretical. Give me some examples. And I think we're, given that background, I think we're just in the right position right now with biofortification. So I wanted to start my talk with a story. I began my journey looking into biofortification. As you all know, it wasn't called biofortification back in January of 1993. And I had my first appointment. We had funding from USAID to look into this. Ambassador Garvelink mentioned that they've been here from the start. And my first appointment was at the International Rice Research Institute at Erie with Gurdev Kush. And Gurdev has won the World Food Prize for his work on developing the high-yielding rices for Asia. And so I went in and I tried to discuss this idea of putting more iron in rice. And he's such a gentleman, and he said, nobody ever asked me that question before. He said, what you need to do is you need to find some high iron rice varieties in the germplasm banks, and then we'd have to cross them, with some of the high yielding varieties. And he got up and he went over to his shelf and he pulled the book off the shelf and he said, let me see if I can find somewhere where it tells me how much iron is in rice. And he looked and I think he found some data. If we think about what Erie did with the Green Revolution, with their work, the modern varieties of rice spread to 95% of rice production in South Asia. That work, the result of that work, they entered the households in India, Bangladesh, other countries 3 times a day. They did the research at Erie, the seeds went out, they were spread, they were disseminated, and 3 times a day they had an effect on what happened to the nutrition of millions, hundreds of millions of people. And yet I had that conversation with Gurdev in 1993, and he said, nobody ever asked me how much iron was in rice. I didn't know as much about zinc then, but I would have asked him about zinc, and he wouldn't have known how much zinc in rice either. But now what do we know now that we didn't know in 1993? Well, we know that when the iron is, we do have high iron rice varieties before it's been milled, and the iron gets put in the outer layer, but when it's milled, most of the iron is milled away. Not too much of it makes its way into the endosperm. So it turns out rice is not a very, milled rice is not a very good source of iron, and we don't really have varieties where we can breed high iron rices. We can add some iron, but not to the levels that we want to. It's a much different case with zinc. The zinc gets into the endosperm, and when we mill, some zinc is lost, but not that much of it. And now we've done surveys, and we know now that poor rural households in Bangladesh get half of their zinc from rice. And yet we had no knowledge of that in the CGR and with the Green Revolution. So I think it shows that that we really need to use agriculture, and that we can use agriculture. We're now breeding high zinc varieties. As the slide says, agriculture is the primary source of essential minerals and vitamins. It's a simple truth. but we often don't recognize it. And if it's broken, if our food systems don't provide the essential minerals and vitamins, then agriculture is a primary way of fixing the problem. If the problem is there, we have to use agriculture to fix the problem. It's not the only way to fix it, but we have to use agriculture. So why have solutions to malnutrition been sought outside of agriculture? Well, we've talked already, the panels have talked about that, but there's a quote that I like to read that sort of exemplifies that. Such intimately related subjects as agriculture, food, nutrition, and health have become split up into innumerable, rigid, and self-contained little units in the hands of some group of specialists. The experts, as their studies become concentrated on smaller and smaller fragments, soon find themselves learning more and more about less and less. The remedy is to look at the whole field covered by crop production, animal husbandry, food, nutrition, and health as one related subject, and then to realize the great principle that the birthright of every crop, every animal, and every human being is health. And that sounds like such a timely comment. It certainly would seem to apply to today. But it was actually published, it was actually written in 1945 in a book called The Soil and Health by Sir Albert Howard. So here we are, we're really 65 years later, and in some ways we're in the same place as we were back then. So what we're here to discuss at this conference then is to really change the paradigm and to link agriculture and nutrition. And it's gonna take some resolve. I mean, it's gonna take some vision, and it's gonna take long-term resolve. We're gonna have to stick with this and stick with this and stick with this over a long period of time. So there are many ways, as Lawrence discussed in his paper, there are many ways that agriculture and nutrition are linked. And we're here just to discuss one way that they're linked, and that's biofortification. But I'm especially excited because we're ready to release varieties, we're ready to have impact, and we're ready to measure impact. So let's review briefly what are some of the advantages, comparative advantages of biofortification. First of all, by biofortifying food staples, we're targeting the poor. This is illustrated by these data from rural Bangladesh. 80% of calories come from rice, just 3% from fish and animal products, and 17% from non-staple foods. But it's those green and red pie slices which are the foods that have the highest levels of bioavailable minerals and vitamins. The poor in rural Bangladesh spend 40% of their income on those green and red slices. They want to eat those foods, but they simply can't afford them. Over the long term, we want to raise incomes. We want diets to be varied. That's the ultimate solution. But along the way, we want to put more minerals and vitamins in that brown slice, that huge brown slice, because that's what people are currently eating. So biofortification targets the poor. Second, we feel that it's sustainable. Once those biofortified foods are out in the food systems, they're available year after year after year. You've front-loaded the investments in agricultural research and getting the varieties adopted, and then they're there. And I want to illustrate how biofortification can be relevant under changing circumstances. This is a graph that Ross Welch gave to me many years ago, and it shows what happened to cereal production and population and non-staple food production from the early days of the Green Revolution until 2000. Population doubled, but the great accomplishment of the Green Revolution is that cereal production more than doubled. However, all sorts of non-staple foods and animal and fish products, that green wedge and that red wedge in the previous diagram, production increased. In this case, in this graph, pulse production increased by 25%, but it didn't keep pace with population growth. Pulses are just a marker for a whole range of non-staple foods. What happens to food prices in this type of situation? Well, when the cereal production outstripped the demand, as represented by population growth, rice prices in Bangladesh fell by 40% over that period. However, the prices of all the non-staple foods went up over time. For example, fish prices doubled from 1970 to 2000 in Bangladesh. So it was easier to keep from going hungry, it was cheaper to keep from going hungry, but it was more expensive to buy the minerals and vitamins that people needed. So I talked about changing circumstances. Well, we had the food price crisis. The diagram on the left shows how the rural Bangladesh people spent their budgets before the food price crisis. The lower price of rice allowed them just to spend 1/3 of their total income on rice to get what they wanted to keep from going hungry. They could spend 1/3 of their budget on the mineral and vitamin-rich foods that improve the quality, even though they were small amounts, and about 1/3 for non-food. Then what the diagram on the right shows is what happens when you have a 50% increase in food prices across the board, as happened with the food price crisis. What the poor do, they have to defend their rice consumption in the case of Bangladesh. The price of rice went up, they have to spend more for their rice, because that's the primary thing they do. They maintain their rice consumption to keep from going hungry, so they have less money. So they have to spend less on the green parts, on the red parts, the diet that contains high minerals and vitamins. Moreover, they have less to spend, and moreover, the prices are even higher than before. So that small amount of non-staple foods, the quality part of the diet goes down even further, as do expenditures on non-food. So even with the food price crisis, even more now, biofortification can help. In this simulation, iron intakes already low decreased by 30%. So more than ever, biofortification can help to address mineral and vitamin deficiency. Now the drawback to plant breeding is that from start to finish it can take 10 years to develop varieties and get official release. But now, finally, we've been working on this for 7, 8, 9 years, and so we're ready to release varieties. So we're targeted, obviously biofortification is targeted at the rural poor. We work our ways, we hit the rural poor first, and we work our way into the urban areas as marketed surpluses get into the marketing system. This complements supplements and fortification which work best in urban areas, which reach into rural areas as markets and the economy develops. And finally, biofortification is cost effective. This is what started me down the road. I'm an economist by training. By doing the research at a central location, developing the varieties, and then making the seeds available in country after country, and as those get into the food system, they're available year after year after year. It's a very cost-effective front loading of your investment. So a group of economists 2 years ago in Copenhagen, which included 5 Nobel-winning economists, they were asked, if you had $75 billion, please tell us what are the 30 most productive investments that we can make in developing countries. This slide shows the top 5 of the top 30. you can see that 3 out of the top 5 address micronutrient malnutrition. Supplementation came in first, fortification came in third, and biofortification, even though we're not really out the door yet, we still came in fifth because of the powerful arguments that justify the investments in biofortification that I've just gone through. So, will biofortification work? I like to break it down into 3 simple questions, and if we can get a yes to each one of those 3 simple questions, it will work. The first is, can the breeders increase the nutrient levels to the targets that we've set for them? We asked the nutritionists, how much extra iron in rice do we need to add to have an effect on iron deficiency? How much extra provitamin A do we need to put into maize to have a significant health impact on vitamin A deficiency? We worked through the numbers, and the nutritionists gave us those targets, and then we went to the breeders and we asked them, can you hit these targets for specific nutrients? Okay, that's the first question. Then once we have some varieties that are high in the micronutrients, we need to give them to the nutritionists so they can feed them to micronutrient deficient people in controlled situations, undertake efficacy trials, and see whether at those levels of extra nutrients we can improve their micronutrient status. So can we get a yes to that answer? Then the third question. Okay, we have high yielding, high nutrient lines. They're shown to be efficacious. Can we get the farmers to adopt? And can we get the consumers to eat them in sufficient quantities so as to improve the public health status? Can we get a yes to that question? So let me talk a little bit about the progress that we've made over the past 7, 8, 9, 10 years. Not only HarvestPlus, but other programs that work on biofortification as well. So first in breeding, I think it's overwhelming. It's conclusive now. We have a yes to the first question. We can breed for varieties that hit the nutrient target levels that the nutritionists gave us. Breeding pipelines have been established at CGIR centers for a number of crops. We already have, in the breeding programs, we have lines with high nutrients with high yield potential. There's also conclusive evidence. There was a lot of skepticism in the beginning. If you breed more nutrients into the crops, you're going to have lower yields. Biofortification is pretty much a non-starter if that's true. So we studied that question very carefully. And we have very conclusive evidence that there's no trade-off between yields and high mineral and vitamin content. We can combine the superior agronomic characteristics with the high nutrient content. It does cost more money. If you have a set amount of money and you add a breeding objective of high nutrients, you can't get as high yields with that. But if you give the breeders more money, they make more crosses, they expand their breeding programs, they can come up with high yielding varieties that are the best ones out there that are high in mineral and vitamin content. I've talked about conventional breeding. A lot of progress has been made with biofortified transgenic crops. I was speaking recently with Gerard Berry of Erie. He feels that by early 2013, golden rice will be ready, will have official release in the Philippines. Biocassava Plus, high provitamin A banana, 2 other Grand Challenge number 9 projects are making great progress. Another requirement of breeding is development of high throughput, low cost methodologies to measure the nutrients in the crops. Breeders make thousands of crosses. They have to make quick decisions about whether this cross has the gene, has the nutrient, should be advanced in the breeding program, and whether this line that doesn't should be thrown away. They can't wait a long time to make that determination to have efficient breeding programs. We've been able to develop those high throughput methods. We even went to the mining industry that has an X-ray gun that they use for measuring the trace minerals in rocks. And we're almost now at the point where we can take this gun out to the field and shoot it at a crop in the field and be able to get a fairly accurate measure of the amount of trace minerals in the crop. So we've made good progress, great progress with developing high throughput, low cost methodologies. Key genes have been identified that are responsible for the synthesis of minerals and the synthesis of vitamins and the translocation of minerals in crops. This makes our breeding more efficient. We've transferred the lines to NARS breeding, agricultural research institutes, and we've developed capacity in developing countries for breeding biofortified crops. And as I mentioned at the beginning now, several lines are ready to be released in the next 1 to 3 years. So we've made very substantial progress in breeding. I'll talk a little bit about progress in nutrition. A lot of questions in the beginning. What is the bioavailability of provitamin A? What is the bioavailability of iron and zinc? Well, we found that the bioavailability of iron and zinc is pretty much what we assumed in setting our target levels. If the bioavailability had been lower, we would have had to raise our target levels even further. So we have positive evidence there. The really good news is for provitamin A, the bioavailability is twice as good as we had assumed. So we can actually lower our target levels. Some of these findings, everything on the breeding and the nutrition that I'm discussing here, will be discussed in more detail in the workshops that we'll be holding in the afternoons. A lot of questions about what staple food consumption. We had some estimates of what we thought staple food consumption was among 3 to 5 year olds, what we thought it was among adult women. And we've gone out and we've done surveys to measure those levels of consumption, and they've more or less been borne out. Our assumptions have been borne out. Staple food consumption is very high among the rural poor. Lots of questions about the retention of vitamins and minerals in storage and processing. We've found actually that that in processing and cooking, the provitamin A retention is better than we had thought it might be. Although in storage, after many months of storage, it's been lower than we thought. But in general, we've been able to hold our target levels with the new data. The new data have validated our target levels and even allowed us to lower the target levels. And we have positive evidence now from efficacy trials for orange sweet potato and for high iron rice. And we do have effectiveness evidence now for orange sweet potato. And I'll talk about that in a little bit. So what's our evidence? What's our progress on delivery and impact? Well, we do have some evidence, although we're just getting started. In Brazil, I encourage anybody who wants to see the future of biofortification to visit Brazil. They're working on 11 crops. They have releases of biofortified crops for some of those. And this is already a picture in the northeast of Brazil where biofortified foods are being consumed in school feeding programs. So we're already having some impact in Brazil. And we've just completed a pilot dissemination project of orange sweet potato, and there's a workshop that is dedicated to our findings with this project. And Jan Lowe will also talk about this in the workshop on delivery of provitamin A crops, where we disseminated orange sweet potato to 24,000 target households in Uganda and Mozambique. And we found that vitamin A intakes went up. First of all, we got 75% adoption, and we found out that vitamin A intakes increased substantially. So we are learning about the best ways of keeping costs low for affecting farmer adoption and consumption of the biofortified crops. I don't want to give too many results because I want you to go to the workshops. Okay, so what's the way forward? So I think this is a key reason for the conference. What roadblocks, what constraints do we have to overcome in the next 3 to 5 years for biofortification to be successful, for biofortification to be sustainable? Well, I'm going to give you my five key constraints, my 5 key roadblocks. And I want you to think about what your priorities are here, what you would add to the list, what you would subtract from the list. And we're going to come back on Thursday morning, and we're going to discuss again what we think those 5 key issues are. And then we're going to put those up on a blog after the conference, and we're going to continue the discussion for at least a week or 2 after the conference and see if we can come to some kind of consensus. So what are my top 5? First, I think we need to work out optimal delivery strategies for getting the biofortified crops out. We have invisible nutrients in the case of iron and zinc. Do we just piggyback on superior agronomic traits and try to capture a huge percentage of production in the country, like putting fluoride in the water? For visible traits such as provitamin A, how do we lower? We need to get behavior change. We need to get farmers and consumers to eat the orange varieties. How do we do that at low cost? Who should our partners be? Do we partner with NGOs? Do we partner with the private sector? Do we partner with government extension agencies? Under what circumstances? Do we subsidize the sale of seeds in any way? Do we just try to increase individual demands at the household level, or do we rely on institutional demands such as through public food distribution systems? So these are just some of the sub-issues within the finding out what are the best delivery strategies. Okay, key issue number 2, and this came out very strongly in the previous paper presentation and in the panel. We need to ensure and measure public health impact. There are a lot of issues, sub-issues within this. We got to make sure that when we release biofortified products and we call them biofortified products, we better make sure that the increment in the nutrients is sufficient. We're already seeing cases where biofortified products are being promoted by people who don't understand the science as well, and the increments aren't there, and they're seeing contamination iron and contamination zinc in their measurements, and they're calling them biofortified when they really aren't biofortified. We have to be careful not that we have strict quality control over the release of biofortified crops. How do we get that done? There are a lot of mitigating circumstances that could mask potential effects once we release biofortified crops. We have to know what the malaria levels are in the areas. We have to know what the parasite levels are. We have to know what the diet looks like, how many polyphenols, how many phytates are in the diets. So we have to know what cooking and storage practices are. So there's a lot of background information that we need to know when we're trying to measure the public health impacts of these varieties. But we can't get away from carefully and rigorously trying to measure what those impacts are once the biofortified crops are released. Priority number 3. This has to do more with upstream nutrition research to make the potentially to make the biofortification strategy more efficient. There's research out that shows that, for example, prebiotics in diets can increase the bioavailability of a range of trace minerals. It may be much more efficient to be breeding for increased levels of prebiotics in crops, improving the bioavailability, than trying to increase the absolute amounts of minerals themselves. But we need more evidence on that. Somebody mentioned already in the questioning, we're just adding single nutrients to crops. How much good does that do? Don't we need several nutrients at the same time? The same kind of the analogy would be that barrel with one slat very low. Maybe it's good to address that one low slat with a single nutrient, but maybe we need to do multiple micronutrients at the same time. So I think there are a lot of issues where we don't know what the effects of compounds and minerals are through foods in human nutrition, where maybe supplements and fortification, actually more has been invested in research there, and we need to know more about how food impacts on human nutrition. Okay, priority number 4. We need to get the agriculture, the last 2 are institutional issues. We need to get the agricultural sector to prioritize improving nutrition. We need to get the agricultural research centers to make breeding for nutrients just a core activity, not something they do because they get HarvestPlus funding, not something they do because they get funding from some other donor especially for this. How do we make that happen? I think one of the keys is lowering the costs. We need to lower the costs, make it as simple as possible. One of the ways to do that is to know which genes are responsible for high nutrient content and get those genes in all the elite breeding materials in the agricultural research centers. And I think that transgenics have a big role to play here. If you want to put multiple traits in crops at low cost, there's a role here for transgenics to play, and they need to develop their science, but they already have techniques that can help us do that. Demonstrate impact. We go back to the second one. If we can demonstrate impact, that's going to energize the agricultural sector to make it a core activity. And we need to get agricultural donors to insist when they're breeding for drought tolerance, when they're breeding for submergence tolerance, when they're breeding for UG99 resistance. We need the agricultural donors to insist that at the same time they breed the high nutrient contents in, and then we can piggyback on those superior agronomic traits. Priority number 5. It's the other side of the coin, the nutrition community. We need to get the nutrition community to prioritize agriculture, look to agriculture as a key tool for improving nutrition. To get that done, we're going to have to provide much more rigorous evidence through the efficacy trials, through the bioavailability studies. We have positive results so far, but we have a lot of new research in the pipeline that's coming out. To do that, again, we need to demonstrate impact. Nothing is going to have a better effect than demonstrating impact, showing that biofortification works. And finally, I don't think that biofortification will ever be sustainable until we get the nutrition and health community to provide the funding to the agricultural sector for biofortification. I think that's the ultimate goal. Once you achieve that, then I think biofortification is sustainable. Once they recognize that those investments in agriculture are probably even more productive than what they're investing in other sectors, then we will see that biofortification is sustainable and is there for time to come. So that ends my remarks. I don't know whether we'll take questions if we have time, but I will maybe at the end of the questions. Can we get that last slide back on? At the end of the questions, so we have a little time to discuss this, I'm going to come back to this slide, and I want a show of hands. I'm going to ask 1, 2, 3, 4, 5 what you think is the top priority, is the top issue. And then I'm going to ask again on Thursday morning. I'll put those same 5 back up, maybe some new ones that we've come up with during the conference, and we'll see what the group thinks are the top priorities. So.
Any couple of questions, and let's keep it again succinct and to the point.
Hello, very succinct. Mike Grusak with USDA in Houston, the Children's Nutrition Research Center. Howdy, I wonder if you could just maybe expand briefly on the issue of the target levels. You mentioned that we've hit target levels for several of the crops for some of the nutrients, and I don't want us to leave here thinking that we've already succeeded on that and we don't have to do further work on that. My understanding from being involved with HarvestPlus from the beginning is that the target levels that were initially set were sort of mid-levels that would allow us to reach target levels that if we employed those foods in communities, we would be able to measure a health impact, not necessarily the highest level that we may want to achieve overall.
Yes, that's Mike. That's correct. I won't go into the technical details of how we calculated the target nutrients, but we're shooting that those target levels would provide about 40 or 50% of the estimated average requirement, given assumptions about high consumption of that food staple. But definitely, we could introduce these biofortified crops in other countries where the per capita consumption was lower, and we could raise the target levels and still have the same impact at higher target levels. So I don't see us, just like we never stop breeding for higher yields, I don't really see us ever stop breeding for higher nutrient content either. But these are just kind of initial benchmarks that we want to hit so that we can show this impact.
Right here, and we'll go over there.
Is this on?
Yep.
Hi, howdy.
Is it green? Yeah.
Okay, yeah, John Bowman with DAI. Concerning your comment about getting nutrition, mainstreamed into the CG centers, what's been the progress like since the early 90s in terms of getting human nutritionists as core staff members in the CG system?
I'd like to introduce John Bowman. He was my project officer at USAID in 1993 when I had that conversation with Gurdev Kush. Yeah, the situation, John's much different now than it was in 1993. I think that through biofortification, first of all, we're working with 10 centers now, working on biofortified crops. I think that the breeders, the scientists have really bought into the idea. They really like the idea. They really understand how they can impact on nutrition, and that means something to them, and they want to do this research. But they're still at the management level at using core resources of the centers to do this work. We still have a long way to go. Of course, there's a lot of variation in that across the centers. I think the center that's taken this on board first and most completely is the International Potato Center and their work with the orange flesh sweet potato. So if we had all the centers at the same level as SIP, we'd pretty much be there. The others, they like what we're doing. They like that their centers are doing it, but I question if the funding dried up. I question how long the research would last. But I think another 5 years, and after we start showing impacts with their crops, then I think they'll take it on as a core activity.
Thank you. And then there was one, oh, back there. Yep.
Yeah, Matthew Blair, legume breeder, and howdy, it was a great talk. And you always go back to that slide. Well, first you always tell the story about working with the breeders, and I think that's a testament to the breeding effort that's involved in getting these biofortified crops. The question I would have is, how do you rewrite that history of the Green Revolution so that pulses again become important? And is there a way for this challenge program to help in advocacy for pulses in balanced diets, which relates to a question that went to the previous panel?
Yeah, there are two ways of addressing that question. One is, can we promote pulses just as pulses are naturally high in iron. They're much denser in iron than the starchy food staples. So one way of addressing this is to promote the production and the production of these crops to make them available and to lower the prices. We have an example. We're providing a very small amount of money to Dr. Singh in India. He asked a question previously, and he's introducing cowpeas into the rice-wheat rotation system in India, adding a crop to the food system that's naturally high in iron that wasn't in the food system before. So that's one thing that we can do, make sure that they're adapted to these environments. Another thing that we can do is breed for more iron or whatever nutrient we have the germplasm for to breed for. But because the pulse consumption is lower, you have to have a higher increment to have the same amount of impact. So for example, we're working on high iron beans. I introduced Steve Beebe early in the morning. He's been breeding high iron beans for the last 15 years. And now the phaseolus beans have about 50 parts per million iron in them in the normal bean. And he now has beans that have 100 parts per million iron. So he had to breed a 50 part per million increment into that bean because bean consumption is lower per capita than, say, rice consumption or wheat consumption. The higher the per capita consumption, the lower your increment has to be to add a constant amount of nutrient to the diet.
I love the particular passion and dedication that everybody brings to their particular crop. So the legume breeder is very proud. Very good. Should we do these two more, and then we'll get to Howdy's question surveys.
I'm Rufus Cheney with USDA in Beltsville. Converting these ideas in the end requires a seed release program or a certification program. We ordinarily publish new varieties. We've seen changes in fatty acid composition demanded by commercial users. We've seen demands for lower cadmium in crops, which are being met in some countries, so that all new releases have to comply with that goal or they're not released. How can we achieve that goal? What is your system doing to achieve that goal of all new releases will have these characters? If the market demands it, the breeders will make it. It's a matter of whether the market does demand it.
Yeah, that's a good point. It's the equivalent of salt iodization. You require that all salt sold in the country be iodized. The equivalent in plant breeding is to say you cannot release a variety unless it has a certain minimum level of iron, a certain minimum level of zinc. And that, I think that would be a good goal to shoot for and make biofortification sustainable. But we're not quite there yet in terms of we need to lower the costs of doing that. We need to show people that we can do it, that will have an impact. But once we show it has an impact, we've worked out the methodologies, we make it relatively simple, then we can require the private seed companies, not only the government research centers, but the private seed companies to develop those varieties with minimum levels of nutrients. And then it will be feasible because we will have developed the methodologies for making that low cost. It's a great idea.
Over here.
My name is Alina Melse, Wageningen University, the Netherlands. Maybe I'm already taking a leap on the next agenda point. I was thinking about point 4, get agricultural sector to prioritize nutrition. We have been trying to do that in the Netherlands already for more than a decade, to get nutrition on the agenda of the agricultural development agenda. However, we failed, and 2 weeks ago I was in a meeting with the government, and again I think we didn't get it onto the agenda of the Ministry of Agriculture, and I think a lot of countries suffer from the same problem. And I was wondering, maybe during this meeting some suggestions can be raised how to achieve this, and how to get this really on this separation between disciplines, how to unite it.
Yes, yeah, absolutely. This is what we want to be discussing on Thursday morning and to be thinking about as you attend the workshops and listen to the plenary sessions. We need to be thinking about what needs, you have to unpack each one of these major objectives and what needs to get done. Now, if you're talking about doing it in the Netherlands itself or doing it in a poor developing country, the issues can be quite different. In developing countries, of course, agriculture is huge. And in developed countries, agriculture is a relatively small part of the economy. Consumers are educated in developed countries. They can afford to purchase better nutrition for themselves. In developing countries, they can't. So they're very different situations. And the politics and what needs to get done are very different. But they should be done in both places. I agree with that.